I'm so excited. But I didn't even ask you, have you been diagnosed with ADHD?
So I, as I was a kid, I always, just had this really, everything was fast in my mind. And my mom always told me, she's like, because I'm the eldest of three, and my mom always said that, your brain just works really fast. I had a little bit of a stutter when I was growing up, and my mom's like, your brain works faster than your mouth. So I always thought that's what it was. As I got older, got into medicine, I was like, something. I guess people. I know people. I knew not everyone was like this, But then I haven't ever been formally diagnosed, but I do know that I meet a lot of the criterias, and I
Right.
think women present very differently. And a lot of times, it's like, if you're multitasking, if you're doing a lot, it's a good thing. You're supposed to do a lot. And I think women, when different phases of our lives require a different attention. And if you have, if you are a mom, or if you take care of, if you have or you're taking care of your family or parents or whatever, like that multitasking, I think, is a good thing. But sometimes it could just get out of control. So I feel like I've met different criteria at different times of my life, but haven't ever formally been diagnosed.
Yeah, I know. That's what's been so fascinating to me,
Mm-hmm.
interviewing so many different women who were diagnosed at different times of their lives, and
Mm-hmm.
some women who were diagnosed as children but then kind of like forgot, or
Yeah.
because there
Yeah.
are parts of, there are points in your life where your executive function kind of tanks, and then there are times in your life where you're on a roll and things are going
Yeah.
fine.
Yeah.
And
And I think it's just phases of your life which require a different you,
mhm.
where it sometimes, you need a little bit more help. And sometimes you build some mechanisms at that time to kind of cope with it, and sometimes you don't. And I think that's how ADHD should be presented. And that's what I always tell my patients. I'm like, hey, it's not a disability. It's not like a lifelong problem. It's just that you're here because some people are like, I can't believe I went all this time with this, or they feel bad about it. And I'm like, it's not really, let's not to be negative. It's not it's not nothing, it's something to feel bad about. It's not, we can, you found us, let's find ways to make it better from here forward.
Yeah, I think so much of that grief, at least for me in the beginning, and it comes back. I like to call it like a game of snakes and ladders. Like you
Mhm.
feel like you're getting somewhere, and then all of a sudden it's like, oh, wait a
Yeah.
minute.
Yeah. Yeah.
But a lot of that grief, especially looking back at my experience with school, and just how you can't help but feel like, how would my life have been different if
Oh
somebody
yeah.
had seen the signs, right? Because
Yeah.
like by the time I was diagnosed at 45, like by the time you get to this point, to
Hmm.
suddenly be connecting these dots
Hmm.
and realizing like,
Hmm.
hey,
Sorry.
it's
Little
okay.
one's homes.
um there's just so much of that feeling of like what could
Hmm.
have been, and then also realizing a lot of the time like how much you have been kind of gaslit, and how
Exactly.
right, like how much you
Yeah.
actually did struggle without even
Yeah.
realizing it, because sometimes I feel
Yeah.
like we are so busy struggling that we don't think about the
Yeah.
struggle itself, and then when you sort of stop and you're like, wow, yeah, it was
Yeah.
really hard, like and then you're
No,
like,
of
what do I
course.
do with that feeling, because
Yeah.
yeah, I think we are really good at picking ourselves up by the bootstraps and like moving forward, and I
Yeah.
always talk about that in the podcast. Like I think one of our
Hmm.
strengths is grit, and that feeling of
Hmm.
like, what, it
Resilience.
happened, resilience,
Hmm.
or maybe
Hmm.
maybe it's just the sort of the positive side of
Hmm.
forgetfulness and
Hmm.
poor working memory, that you're like, yeah, I'm going to move on from that.
Yeah.
I
Yeah.
don't like to dwell as much,
Yeah.
unless it's a text, then we like
Yeah.
dwell on
Read
the
it, reread it.
we ruminate on that text we sent and being
Yes.
like, why did I send that? Oh God, what's
Yes.
the
Yes.
response going to be? Anyway. Okay, so normally for, I like to ask about kind of how women came to their diagnosis. But for
Okay.
you, I would sort of more be interested in kind of like, how did you get involved with ADHD treatment? I know
Okay.
you've been with ADHD Online for, I guess, since August of 2020, right? So it's been
For
a
a
while,
year.
kind of.
Yeah.
Yeah, how did you really start to specialize in ADHD and
Okay.
kind of make this a highlight of your practice?
Yeah. So I am board certified in preventive medicine public health. I did my training at the Texas Department of State of Health Services. After finishing that, I wanted to do more contracting work because I wanted, I had my first kid in residency. And one thing I realized, when you're in residency or medical training, your time is not your time. So once I finished, I was like, I want to take some time and just do some contracting work, spend some time with my family. And then I had my second, which you saw running around here. So during that time. And then when I finally was like, I want to get back into the working for, like, actually maybe work, find a hospital, a clinic to practice in. That's where the pandemic came in. And because, so everything was kind of transitioning into more practices, telemedicine. And that's when I started getting into more of telepractices. I was working for a telemed workers comp group at that time. And then I was like, well, I need to find something else to keep myself a bit more busy, because with telepractice, things were just starting up. So the volume was a little bit slow at times. That's when I came across ADHD Online. I was sending out my CV and I was like, oh, this looks cool. Let me reach out here. And that's where I initially found them. I was the first physician with them. So it was just literally a handful of us, and we just jumped right in, started seeing patients. We started in Texas, and Pennsylvania were our two states at first. And that's just how things, I started, seeing a lot of patients and seeing the it became apparent very fast that there is a big need for this, especially with the pandemic. One thing in my training that we in from public health standpoint, whether it's a medical emergency, public health, anything, it affects the vulnerable population the most. So we have kids, we have adults who need mental health, who need help for, whether it's your anxiety or just need someone to talk to. They can't get in to see their providers in person. So when they found us online, or just Instagram, TikTok, whatever it was, they were just like, oh, this is interesting. This is great. And they felt like they were getting the care they needed in the comfort of their own home. They felt safe. So that's how the need kind of grew. And now we're in, I don't know, multiple, every time we're adding states, we're in 20 plus states. We have over 80, over 60, 80 providers, maybe. Like, we're just growing really fast. And so it's been, so that's how I kind of found them and kind of started my work with them.
Yeah, it is amazing at how it feels like it is really meeting such an intense need right now, with the pandemic and lockdown, but also just like we are going through this mental health revolution right now.
Yeah.
And as a result, I think, of the pandemic and lockdown, and it's so, I talked to guests in the UK who say there's a 3-year waiting list with the NHS to get an assessment. So they're going to private companies a lot. And it's like, even though things are opening up, like it's hard enough to get a dentist appointment right now. Like, it's crazy how backed up, how, that relatively short shutdown has the ripple effects that it has had throughout the medical community. And just the stress and the overworking, and like not only taking on having to deal with your own issues with the pandemic, but then taking on all of the issues with the clients. Like, it's just so dizzying to think about. And I feel like online telehealth has really just like slid in there and filled this gap so wonderfully.
It's the disparity of healthcare that becomes so apparent, and I think that's where telepractices like ours kind of we're just able to reach more people. And it feels good to be able to be there for them, just even if we can't, even if it's not for some people, I see them like, medications may not be a good time right now, but at least they know that. At least they know, like, hey, maybe this is not the right, what else can I do? So I think it's just as you were saying, it's just wild. These are wild times. And it's really,
It is. And I think even through the lens of ADHD, or even just like to focus in on ADHD in the last couple of years. I mean, that article that came out in the Independent this week about the increase in online diagnoses among women. Did you see that? Like, it was incredible. It was like in 2019, it was like 7,000 women took online assessments. And in 2021, it was like, I have the numbers somewhere. In 2021, it was 250,000. And I'm sure it feels like it's still increasing. Anytime I post anything about ADHD, the comments are like, I think I might have that. Like
Yeah.
it's amazing to me how many women
Yeah.
are still sort of coming to this
Yeah.
realization. Cause at this point, I assume everybody must know, because I know.
Yeah. No, if it always feels like that. It's always like, it's like if you learn one thing, if you know one thing, you think everybody has it too. But I think with women, it just presents so differently. I mean, it's just I have, because of I don't want to say because of the pandemic, but because we've opened up around the pandemic, there is this, I see a lot of women, I see a lot of adult women coming in, and they often present with this mix of anxiety and this hyperactivity. And the hyperactivity is more this mental hyperactivity. I always describe it as you have a lot of tabs open in your brain. You can't focus on one tab long enough, and then you jump, period. Just jumping between things all day long. The second they wake up till they go to bed. And then when they go to bed, they're physically tired because they've done so much, like running, just physical running around.
Mhm.
But their brain doesn't sleep. So their brain wakes up and it's like, we didn't do this, and we forgot the kids, homework or laundry, or so it's like this constant sort of cycle. And it's just, you never get this mental peace. So the hyperactivity that we typically see with ADHD, which is more physical, kids bouncing off the walls, it's more this mental hyperactivity in women. And when I explain it to that, they're like, oh my God, that is so true. Like before the pandemic, they're like, I know I had some of it, but it wasn't that bad. Like I was functional, but then now it's like everybody's home, everybody needs me at the same time. And I think that shift is what a lot of women are seeing, because sometimes people could have ADHD, could have some levels of depression, some levels of anxiety, and not everything is ADHD. But if the root cause if the common denominator is ADHD, then maybe proper treatment, proper management will help everything else. So that's how I think that's when a lot of women come in, that's what they experience, or they've been on anxiety medication or depressive medication in the past, and they're like, I don't know, it's not helping me. Like I feel like I'm on it, but nothing's really happening.
Right. Yeah. I got trapped by that feeling that if it's this bad on the medication, imagine how bad I'll be off the medication. And so I
Yeah.
was
Yeah.
terrified to go off
Yeah.
of it. And I was on
Yeah.
SSRIs and a sort of cocktail of various
Hmm.
medications for depression and anxiety since university. And never really felt like I related to, especially like with postpartum depression and postpartum anxiety.
Oh my gosh.
I was
Yeah.
being treated for that because I was having a lot of emotional regulation issues,
Hmm.
but I
Hmm.
never felt like I fit the profile
Yeah.
of PPD. But at the same time was sort of like, well, SSRIs do work.
Yeah.
They helped me sort of get through the day.
Yeah.
But yeah, always sort of feeling like, yeah, it's just off.
Yeah. There, but not there. And
Yeah.
I think that's the thing. I think, again, our medical, knowledge, or our medical, I guess what's the word? DSM criteria. We have criteria for there's a name for a lot of things, but at the end of it, no one can tell you like what you're presenting is 10% anxiety or 40% ADHD or 20%, postpartum. We want to treat the root cause of it all. So if at that time, if postpartum was going on and this is the treatment, then everything should slowly get better. But if it doesn't, or if you're like, hey, it's not, something else is going on, like I'm still not feeling better, then maybe go back and reassess and find something else. And I think for patients, like that's also really important to understand. I think we're always thinking of like, oh, if I have hypertension, I only have hypertension, but their mental health is a very abstract beast. There's different things that make it up.
Yeah. I always tell myself that like, if if you feel really deeply seen and understood by a lot of the
Hmm.
ADHD stuff you're seeing online, then it's worth
Hmm.
looking into.
Yeah.
Because there's that fear that, oh, well, maybe it's not ADHD, maybe it's something else. And I think,
Yeah.
a lot of that fear comes from a lifelong experience of self-doubt, and also like
Hmm.
feeling like you're just looking for excuses
Yeah.
for your
Yeah.
laziness or your
Yeah.
disorganization. Like I think
Yeah.
we tend to get to adulthood feeling like like the best way I've ever heard it described was piece of shit syndrome. which is just like, feeling
Yeah.
like there's,
Yeah.
feeling like you're inadequate and you're always looking for
Hmm.
excuses. And maybe an ADHD diagnosis is just one more excuse that you're grasping
Excuse.
onto, right?
Yeah.
And so it amazes me how
Hmm.
much, not only how much self-doubt there is around getting the diagnosis, but even after I was diagnosed,
Yeah.
I still like constantly, I mean, I freaking have a podcast about it. And yet I still have like imposter syndrome around the
Yeah.
diagnosis. Like it's,
Yeah.
and so I just tell myself that that level of self-doubt is a pretty good indicator that I have ADHD.
And I think it's also the stigma of mental health, like it's just people just perceive it very differently. I have patients who are, so the ADHD Online, there's two parts to our treatment arm. One is the assessment. So that's open that's open in all states, and that's done by a licensed psychologist. And that so in order to, so some people just need the assessment. With that assessment, they can go to their private care or wherever they want to, but they need that assessment, and that's one aspect. If you with that, you can also come get treatment through us, and that's the medical management side. And I have patients who've been assessed. It's the first time coming in, but they start off with like telling me that they have it, or that just kind of explaining themselves. And I'm like, look, I you're diagnosed with it. I understand that. I mean, I know you have it. I'm just trying to understand a little bit about your day to day or something. But then they start with this whole like, well, like it's like they're fighting for their diagnosis, or fighting for, it's like it's because. And a couple of times I've kind of explained to them, like, look, I know you have it. I'm not doubting your diagnosis. I just want to know what's the best, medical option. Should we do this one or that one, like that kind of thing? And so they actually get taken aback, and they're like, I'm sorry, I don't know why I'm doing this, but I've always had to like fight for it before. It's the first time it's kind of like, oh, it's so easy. Like, I don't know how to act, And I'm like, no. And that's the thing. I think the mental health stigma is there, but sometimes depending on, at what point of your life you get seen. Like if you're in school not doing well, or maybe getting in trouble all the time, maybe it's easier to say, okay, you're just, you have discipline issues and it's not ADHD. Or if you're older in life and it's like, well, you're just, and you're, maybe not doing things you need to do, it's like, well, it's because of this. So it's like, I think people don't want, the way the diagnosis is perceived, it's kind of like, oh, because you're doing this, it's maybe due to disciplinary issues. It's not, it's always seen as like if nothing else fits, then it could be ADHD, but I don't think
Yeah.
it should be seen that way.
Well, and I think there's also the belief that, you really could get your act together if you tried hard
Yeah,
enough, right? Like
exactly.
the
Exactly.
belief that
Yeah.
like at the
Yeah.
end of the day, you're just not
Yeah.
trying hard enough.
Yeah.
And
Yeah.
we internalize that belief because we're told that,
Yeah.
thousands
Yeah.
of times
For a
throughout
very
our
long
life.
time.
Yeah.
Yeah.
So now with this kind of like increase in diagnoses, especially among adults and adult women, like how do you think this is going to be changing the face of ADHD and that stigma? Because that's what I get excited about, right? I mean, that's what
Yeah.
this advocacy is for, and
Yeah.
spreading the word and showing
Yeah.
like, I, it, I feel like that we have this opportunity to really um, expand how ADHD is looked at, like in the education system and
Yeah.
in for
Yeah.
our self identity. What do you
Hmm.
feel like this? Even though there's this backlash right now that it's just trendy and and everybody's a little ADHD and all of
Yeah.
that.
Yeah.
Like, how do you feel like how do you feel like the face of ADHD is changing?
I think that with now that more people have access to it, they're being that they have a name for what they're feeling or what they're experiencing. I think with that there's this, it's brings a more positive light to it. And I think that if the fact that women are multitasking, we're doing a whole lot during this time period, and I think with that it's a more, it adds to the positivity of it. It's not like you have to be a kid to have it, or this, or you know in your college years or whatever. I think it's being seen as like, oh my gosh, like if you were, I think it's highlighting the fact that we do so, like women are doing so much. Also, you're full time, you're working, taking care of your family, and jumping between a lot of the roles that we have to handle. And I think with that, it brings that aspect of positivity. And I think if if once you start feeling better, once you start doing things, you feel like you're making that difference in yourself. It's that overall you realize, like, your what's the word I'm trying to say, your own sort of day to day gets better. It's more positive reinforcement also, so I think it's not, I don't know how it's going to, in the backlash that ADHD gets, especially in this whole social media world. It's just because everyone's like, oh, everyone's talking about it, everybody has it, that kind of thing. That I don't know how that part will change, and I hope it changes. But I think with the whole social media and trendiness that comes with any diagnosis, I think that's just, that's always uh, that's kind of a different sort of aspect. But I feel more women get diagnosed, the more they will talk about it amongst themselves, and I think that's what's important. So just everyone putting their voice out there, and social media is a great way to do that. But I have a lot of people who found us on TikTok. I didn't even know we were on TikTok. So it's been really exciting to see that kind of married together. But I know that a lot of, because of the pandemic, there's a lot of people who do, post things on social media and I know that some medical providers get a lot of backlash. So they're just like, well, you're just going up there and saying things on this, or, so I think that's
Or you're just looking for meds, which just
yeah.
blows my mind that any medical professional is still thinking of stimulants as, in that way, that somebody is coming
Yeah.
to you and
Yeah.
struggling, and you're
Yeah.
like, well, you're just trying to get, contraband.
Yeah.
But
Yeah.
so oh shoot, I lost my train of thought. So I was curious, I wanted to find out a lot more about the testing, the online testing, like, because you mentioned, I kind of assumed that it was just like a multiple choice test. What is are you actually speaking with a psychologist or
Yeah.
psychiatrist? So walk me
So
through the
yeah.
testing process with
Yes.
ADHD
So
Online.
we have so say you're looking to get diagnosed, you're like, hey, I think I have ADHD. I just saw on TikTok, maybe I meet criteria. So you come onto our website, and then you'll have you'll register, and then there's a bunch of questions in there. The questions will ask you things about just, medical background, like medical history, surgical history, that kind of thing, family history, social history, anything. The questions on anxiety, question on depression, like just to, and there are free text kind of questions. And then at the end of it, this is an asynchronous sort of visit. So once you finish that questionnaire, then it gets sent to a licensed one of our licensed psychologists, and they're the ones who'll look over it and assess it and say, okay, based on this, you meet criteria for ADHD and attentive type or combined type or whatever the case is. But it seems like, you also answered positive to some of the questions in anxiety, or some of the questions in depression, and then they have a plan sort of highlighted in there. Sometimes some patients will mention, they may have thoughts of hurting themselves, or thoughts of hurting others, and then at that time the psychologist may reach out to them and be like, hey, you talked about this, I just want to find a little bit more, here's some numbers to reach out to, that kind of thing. Or so the assessment is just based on the way those questions were answered. Somebody, you can meet diagnostic criteria for ADHD, but we also want to highlight depression, anxiety, and other mental health conditions, because not everybody it's not always a clear-cut ADHD diagnosis. You can have a little bit of other things also. So the assessment kind of looks at all that. So we have our department, our division chief for the psychologist is Dr. Gail Savoy. I think it'd be nice if maybe 3 of us could be on the top, like maybe we could, so that way you can, have questions for her, questions for me. So it's more comprehensive. I don't know if that would be something interesting.
Yeah. Yeah, absolutely. That would be great. Because I think, the number one question I get asked in my Instagram DMs all the time, which is, how do I get diagnosed? And I love just being able to like send people to you guys.
Yeah,
because,
of course. Yes,
right. Because it's
do.
so,
yeah.
I think, so many of us, I had such a great experience with my doctor, but my doctor is also a psych NP. So it was really relatively painless experience. I had a
Yeah,
relationship
yeah,
with her already.
yeah,
I brought all of my self-tests and all of my paperwork with
yeah,
me. And she was
yeah,
like, yeah, don't worry. You don't, it was the same experience where I was like so terrified she was going to
yeah,
say, no, it's not
yeah,
ADHD. And then I would be like,
yeah,
well, now what,
yeah,
And,
yeah.
and so it's been a relatively wonderful experience for me, but like I hear so many terrible stories about women who go to their doctor really feeling like this, could be the answer to so many random struggles
Yeah,
throughout their lives. And the
yeah,
doctors just are like, oh, go get a good night's sleep. You're a mom. This is
yeah.
typical. Or my
I've
favorite,
actually heard them.
right?
Patients have said that to me.
And or my favorite is, you've made it this far. What's the point in getting a
That's the
diagnosis? And
point.
it's
Yeah,
like,
yeah. I've
um,
had patients say that to me, and I'm just like, I'm so sorry someone said that to you. I'm so sorry someone told you like kids are the answer to your, to your life. Or I just, it
or
really baffles. I don't know why someone would say that. Like it's
yeah.
not. I would never see that. I would never say that as a response to anybody, to any of my patients. So it it's confusing, but women hear that quite more often than men do. So
Yeah. Or my another one that I love is you didn't struggle in school. You didn't struggle as a girl. And so therefore
yeah,
you can't possibly have it as an adult. And it's like nobody knew anything about ADHD in
yes,
girls.
yes,
So of course I wasn't diagnosed as a
yeah,
child. How are you
yeah,
using that as
yeah,
evidence that I don't have it now? But I think, really the idea is that the fact that there's just like, I think we're at this crossroads where people are getting a lot of their information online from social media. They're
yeah,
seeing these lived experiences of social media influencers, for good or for bad. This is how the information is spreading. And then they're going to
yeah,
their doctors who just have no clue what is
yeah,
happening and don't know really much beyond the DSM. And
yeah,
so then we get to this big question, which is like, okay, well, what is this? Is this ADHD? Is it
yeah,
not? I don't know.
yeah,
And it's dangerous to self-diagnose. And we have so many of these questions around this right now. And so it's so
hmm,
nice to know that there is like a place where you have people who know what they're doing, they're experts
hmm,
in this specific topic,
hmm,
and can look at these comorbidities and look at some of these other
hmm,
red flags and help us parse it out, because I think that's what is the big confusion right now, like, right,
yeah, yeah,
and like you said
yeah.
right at the beginning, which was, even if it's not ADHD, like there's some executive functioning
What is
issues that
it? Yeah,
everybody is experiencing right now for a lot of
yeah,
reasons. So
yeah,
let's deal
yeah,
with those as well.
yeah, yeah. And I think I have some patients who just want to. They're like, I don't know. They're like, I know, I did your assessment. I guess I have ADHD, but I just want to talk to somebody about it. And so we'll talk about it. And at the end of it, they're like, you know what? I'm now that I know and things you say make sense. I guess they want to do therapy, or they want to, now that they know, they want to see if they can do things on their own and then come back if they feel like. So I think it's nice to be able to open that door for them and just say,
Well,
hey, we're here for you. If you want to come back, more than welcome to come back anytime. So I think that's important also for people to know that, okay, I have someone to go to.
yeah. Well, I mean, it's crazy. It's expensive. It's overwhelming.
Hmm,
It's
hmm.
one thing to get a diagnosis, but then it's another thing to get hit with, $50 a month medical
Oh yeah. Yeah.
prescription bills. And then
Yeah.
also like, okay, well, now I have to make room in my budget for therapy. And, like
Yeah.
there's a lot
Yeah.
of expenses that get thrown at you in terms of
Yeah.
treatment. And, we're not always the best with budgeting. So
Yeah.
you have to
Oh,
deal with
that's a
your
whole
financial
different
issues,
topic. Yeah.
right?
Yeah. Yeah.
So yeah, it is overwhelming. And I see, and I think we're also just like have a tendency to not bring in help in our lives. And we have a tendency to
Hmm.
be like, I think somebody with ADHD and undiagnosed ADHD has spent their whole life being like, I can just figure this out by myself, right? I just need to try
Yeah.
harder. I just need to do a little
Yeah.
more research. I'm just going to do this.
Yeah.
Let me just Google a little bit more. And there's always this sense of like, the answer is just around the corner. I just need to
Yeah.
figure out how to
Just
get
a
there.
little bit more. Because
Right.
that's how it's been, you've been told all your life. So that's what you think, like if I just
Mhm.
spent 10 more minutes on this, it's right there, and that 10 minutes could be the most painful 10 minutes ever because, it just adds more and more to that. And then, yeah, and that in turn can add to those levels of, if you don't get the answer or even need more time, that could add to more of those levels of negative self-thought and just more to the anxiety feeling. So it's just, in a sense, it's a vicious cycle
Mhm.
that's just not ending.
I know, right? So I
Mhm.
love, I kind of joke with other people about the idea of like the diagnosis process for ADHD is basically the test for ADHD because it feels like such a
Yeah,
maze and there's so
yeah,
many hurdles to even just get there and then to get the treatment. And
yeah,
it's so exhausting. And chances are you're already chronically overwhelmed to begin with. And
yeah,
deep sigh.
that's true.
Um, so now, what would you say to the skeptics when it comes to online assessment? So, I feel like there is this because the telehealth and the online assessments have come in, they're relatively new, they're filling a gap.
Mhm,
But there could be the fear that they are capitalizing on these sort of need for urgency, or this idea of like, I just want to get this diagnosis quickly, I don't want to have to do the work, that there's a sense
mhm,
that there's it's a business. So I think there is some mistrust that comes with online assessments as opposed to going to your doctor, even if your
mhm.
doctor is like, an 80-year-old guy who has no idea what you're talking about and tells you you're
Yeah,
not a
yeah,
hyperactive boy. But like,
yeah.
how do you address the skeptics in the room?
I think it's the healthcare is changing. I think everyone is so used to going to seeing a provider in person, that brick and mortar sort of feeling. Like now we're changing it to just being like, hey, here it is. So the efficiency, the fact that it's faster, I think that's what people feel like, what is this even real? Like it's so fast to do it. I'm usually three used to waiting 3 months to see my doctor and then 20 minutes in the waiting room, so it's that's what people are used to, because that's what we're told is the right way to do it in a sense. But this way, it's same assessment, it's or similar assessments that we're doing at our follow-ups and at our visits and everything, but it's just faster. So it's that, I think that's the part that the assess and we in any medical practice, whether it's online or in person, we are practicing there is a standard of care we want to meet. We want to make sure that the patients, any medication we prescribe, anything we talk, anything we do, it is, it's safe. Patients have a way to reach back out to us if they have questions or concerns, or if they're not liking the medication or whatever the case is. And there is it's the same practice, but just online. Just everything is just, you're not going into a building, you're not going into a brick and mortar. But I think this skeptics come in when it comes to like, oh well, I'm used to doing something else, this is so much faster, so is it real? That's the kind of, I guess, response I've seen. And I try to tell them like it's the same thing. I mean, and and I think just building that trust with patients, that kind of helps too. They're just like, oh, so you're a real doctor. This is real practice. This is your real medication. I send in a prescription to the pharmacy. They were able to pick it up. And so I think all that is like, oh my God, you're not just like a bot sitting somewhere talking to me. And all our visits are done through like a like a Zoom like this. So they're able to see me in my home. Sometimes my kid runs around and they're like, oh, you're a real person. And then all of us are like, so I think that sort of builds it up a little bit. But initially people who, come to us are just like, I didn't know about you guys. I just did this online 2 a.m. because I couldn't sleep. And now I'm here. So, so I think, yeah, so to answer your question in a very roundabout way, I think it's just that I think the skeptics is just, they're used to doing something in a different way, in a brick and mortar fashion. Things take longer, and that's what we're used to. So now we're changing it, and it's like, is this real? I mean, that's where it comes from. So the efficiency.
Yeah, I know. I like that answer. It says a lot about the American medical system that, that
Oh gosh,
if
it's
something isn't painful and arduous, then it must not be real.
that's literally exactly what it is. They're just it's crazy. It's crazy how much you have to, you advocate for your health in so many ways here. And here we're just trying to be like, our waiting period for some states is a bit longer, but we are growing very fast. So that's cutting down also.
Mhm.
But at the same time, it's just, when you hear that, wait to go to a brick and mortar, it's like 3 months in some places. Some places, depending on if they're in, like I'm in Texas, in rural Texas, there sometimes there's more cattle than people in some counties, so just for them to get treatment, you have to wait even longer or drive hours to actually go to a specialist.
Oh,
So this is just helping. Yeah, the efficiency is there.
yeah, absolutely. I know. I grew up in Canada and moved to the States when I was 27. So I always laugh because I'm like, there is a better way, people.
Yeah. Well,
Whenever
Canada,
Americans
yeah,
start talking
yeah.
about how we're the cream of the crop, and I'm like, oh, where do I even start? Um, that's another podcast. But anyway, the do you now? I know with the prescriptive visits and the therapy, I know that's sort of on a state by state basis, but do you assess internationally? I guess my question is, can you assess anybody who, do you have to be in the US to get your assessment through ADHD Online?
So yes, the
Okay.
medications. So we're the way the medication parts of every state has different state laws when it comes to, because most of the ADHD medication, the stimulants are controlled substances. So if you get prescribed a stimulant, states have certain laws on that. Every state is different, but um, those are all within the US. We're not assessing, we're not open to patients internationally. I think you can get, I'll have to ask the AT and like just the team if we can do assessments for internationally. But I
Mhm.
think this, because the assessment is like anybody can get assessed, and you can take that assessment to your medical provider in person if you want to, So I think that part could maybe available, but the medical management part, that is for US only.
Right. Okay. That's what I was curious about. Yeah.
Mhm.
Because, it also feels like with this social media revolution, like it's amazing to me how how ADHD just is becoming more and more of a concept, or I guess it's, there are definitely certain countries that embrace mental health, and there are
Mhm.
some countries that there's no there's no such thing as mental health, right?
Yeah.
And so it's always like
Yeah.
I didn't really think about it much until I started going on Clubhouse at the beginning of last year, and there was a
Mhm.
lot of like interesting ADHD Clubhouse rooms and conversation, but it was so fascinating to me, from very, for certain continents where people were just like, this was the first
Mhm.
time they were even exploring
Mhm.
ADHD. And it was like, I can't tell my family about it. I can't talk about,
Yeah.
this is just,
Yeah.
this is not something that I could ever actually explore. So I think
Mental
in
health
that,
stigma. Yeah. Sorry, go ahead.
I was just going to say, I think in that realm, in terms of like the stigma, I think the US is probably a lot more laid back than a
Yeah.
lot of other
Yeah.
continents.
I mean, we still have stigma around it, but mental health stigma in the eastern part of the world, it's deep. I mean, they don't, in some countries, if you go in with the stimulant, it's banned in those countries. Like you can't bring, even if so, even if our patients are traveling, we've asked them, be like, hey, if you need a letter, please check with your country. This is, and because if you take your medication with you and you get I mean, again, for some countries, a stimulant medication is banned to enter, but unless you have the appropriate paperwork and stuff. So it's not even seen as a possible diagnosis.
Mhm.
Um, but yeah, and like especially in like the eastern part of the world, it's very, it's just not around. No one talks about it. No one thinks that's it. Again, you're lazy, stop doing this, focus more on, stop playing with your friends, focus on your studying. Like that's kind of the thought process there.
Right. It's like self-indulgent to even think
Hmm.
about
Yeah.
your own
Yeah. If you're
personal
thinking,
mental health.
yeah, if you're thinking about it, you have way too much time, you're not studying. So go pick up your book.
Good.
Yeah. Yeah.
uh,
I grew up in Saudi Arabia, and it's a very like I went to elementary school out there. I was there up until junior high, and it's never occurred to me that this was even a diagnosis. My bubble was just going to school, come back, pass your classes, blah blah. And then that time I went to that the I was in a US based school there, or US curriculum school. So we had classes only up until the ninth grade at that time. And then if you wanted for high school, you would either uh, most of us would go to boarding schools, whether it was in London, if it was the US or whatever. So I went to an all girls boarding school in Maryland, and it was just like my world was always just gotta study this, pass this, so I can do the next thing. It's like, so it's never thoughts of mental health or any depression, anxiety, ADHD never crossed my mind. And then, but now that I'm in this ADHD online world, I see high school kids. I see parents bringing their kids in. I'm like, this is amazing. This is amazing that you're so, like, you're, as parents, you're open to the diagnosis, because I mean, for kids, for minors, you need to come with parents, so if your parents are, the fact that you guys had this discussion, it's just amazing to see that, like, it's just the stigma is slowly breaking down.
Yeah, I think, so many women I interview came to their diagnosis through their children,
Yeah, I
where
see
they were
that
like,
too.
oh, wait a minute, these traits I experienced all of these and
I
throughout
see
my
that
whole
too.
life, right?
Yeah, yeah.
Uh, Whereas I did not come to it through my children, but now I have almost 15-year-old and a 10-year-old. And so, I'm
Yeah,
going through everything they
yeah,
do. We evaluate it, we
yeah,
talk about it. Do I have
yeah,
ADHD? Do I not? I
yeah,
don't know.
yeah,
I have a girl and a boy, so they're both so different in terms of how it
yeah.
presents. And it's always fascinating to me to think about how much my own parenting has changed since my own diagnosis, just in terms of like realizing the importance of accommodations and realizing the importance
Hmm.
of like environment, and how you are not the problem is the environment, right?
Yeah.
And just
External
that's
stressors,
yeah.
external stimuli. Hmm.
Right, exactly. And so it's like you just approach issue. We approach problems very, very differently, as opposed to
Hmm.
being like, what's wrong with me that I can't do this thing?
Hmm.
It's like,
Hmm.
right away, I'm teaching my kids that like they are not the problem. And so they can say, okay, if this isn't working, now I can look
Hmm.
outside of myself and be like, what is
Hmm.
not working for me? And what do I need to succeed? As opposed to
Hmm.
like, I feel like in my life, I just was like, I'm not succeeding. Everybody else is. What's wrong with me? I'm going to just give up and lie here in the fetal position.
Yeah.
or
Yeah.
or just like try really,
Yes.
really hard and push it and eventually
Yeah.
get through and make it,
Yeah.
and then fall to it, fall to the floor exhausted. That's the other
Yeah.
thing, right?
Yeah.
Just like
That's
we having
exactly.
to do twice the work for the same amount of for the same
Yeah.
result as so many other people.
Yeah. So by the time we get your goal, you're mentally and physically exhausted because worked double, you've done double the work in a sense.
Mm-hmm.
But yeah, no, I often see myself with my kids. I'm always looking at, like, I mean, TikTok and Instagram are just great resources for, if you should find the right thing. I mean, there's good and bad everywhere, but I always find things on, like, how to parent toddlers, things like tips like that. I'm always looking at things like that. I'm like, this is interesting to include in my parenting. But for my parents, it was a different generation. They thought very differently, and they were not as, I mean, they're great parents. But at the same time, it's like, I guess now parenting is, you're more, there's, the resources are different, so you approach things a bit differently. And our kids now they're living through a pandemic. Everyone's showing it very differently. I mean, I have a 6-year-old and I have a 3-year-old, and they're they're they show it very differently, versus I see kids who are in their, they're 10-year-olds, they're preteens, they show it very differently. And it's just, it's like, but as parents, you want to be open to them and be in tune to that, and not just say, oh, it's, go to your room and do it again, like, just I see parents as kind of having they have this very friendly relationship, I guess, with their kids versus the
Yeah,
older generation.
I hope this generation of parents kind of realizes that corporal punishment and the like sit in your room and sit in the corner and think about it,
Yeah,
like all of the
yeah,
ways in which we were punished growing up, like I
yeah,
think we've all learned that they're terrible. They're
yeah,
terrible ways to discipline
yeah,
children, and that there is a more like cooperative approach that
yeah.
could work
I
with.
saw this thing where it's like, I don't, like, you don't do timeouts anymore. We do like time ins. Like, okay, let's take a deep breath and come back. And so before, it's always like, I'll go to your room and sit in timeout and all that stuff. But now it's like, wait, let's take a deep breath and let's reassess and try to approach this a little bit more carefully. So I think and that's something new. I never realized that before. And I'm like, oh my gosh, this is, timeout is so archaic now. You want to be able to engage your kid. Your kid is telling you something, and let's be open to it.
Right. I know. And I think I read in a book recently, I think it was Dr. Sharon Saleen's book where she was talking about like the best reward for any kid is time with you, right?
Yes.
Like all they want is more time with
Yes.
you. And that can be hard as a
Yes.
parent because you
Yeah.
do need your space. But
Oh
it was
yeah.
just a reminder of like how time apart, like the way, separating and making them
Hmm.
sit by themselves and doing
Yeah.
anything alone is really like akin to torture for certain age
Yeah.
groups.
Yeah.
And then I thought about like body doubling, right? And how like with my children, like one of the hardest things that my husband and I deal with, because he's neurotypical, and I'm always trying to explain to him that like you can't just tell your child to go clean their room, because
Yeah.
that you're leaving them alone, to
Yeah.
they're
Yeah.
flailing, and it's a
Yeah.
really really difficult task. And like
Hmm.
we need to find the patience to body double. and and it's hard,
Interesting.
right? Because it's
Hmm.
it's hard because like yeah, as a parent you need time away. And so
Yeah.
it's but that's those were those ways in which my own view of parenting has really
Yeah.
shifted, where I'm like, it's just not fair to expect things from a child if you haven't like
Yeah.
really shown them
Yeah.
explicitly how to do
Yeah.
things, and showing them and
Hmm.
spending that time with them
Yeah.
is so
And I think,
important.
yeah, and I think a lot of us, never, like when kids go to school, we drop them off, maybe a bus picks them up at 7 or 8, or you drop them off to school, they come back around 2 or 3. Like this is the first time parents are actually seeing their kids study. They're like, with homeschool, with a hybrid model, they're like, I had no idea my child could not sit down in one place. Like I have and sometimes I ask parents, I'm like, so what brings you guys in today? Like why seek treatment now? And so the parents are like, I had no idea my child was so disruptive. Like they're just walking around they can't sit down in one place. I had no idea. At first, they're like, what teachers would mention it. I always thought that the teacher's not good, like something like that. But now they're like, I'm actually seeing it. Or I can't believe I have to tell my kid like 100 times to do something, they still don't do it. So it's like, I think if you're not either showing your kids or you're not seeing that, like, how do you know what to do?
Yeah.
um yeah, so it's interesting. I mean, this the the pandemic has, I guess, in one way brought us away from each other, but also close as families, because then you're realizing so many things about ourselves, about each other. It's the first time my kids actually know what I'm doing. I don't think they're little. They don't really know much besides Mickey Mouse or Elsa, whatever. But now they're like, oh, they were like, mommy's a doctor and mommy sees patients on telemedicine. Like my son tells people, well, my mom sees patients on telemedicine. She's a telemedicine doctor, and it's like then they know, like, okay, you're here, you're with your patients, and then anytime I'm done, my my daughter's like, how many patients do you have? 2 more, 3 more? Because they know that this is something she does. This is how this is how she works. But then if I have to go back on a call or something like that, they're always like, you're always working. Because sometimes I see patients on different time zones. So it's like evening work at times. And they're always like, you're always working. I just want to play with you. And I'm like, okay, guys, I'm almost done. I'm almost done. And it's like that time, like we all need time away, but I think that the time that they have, that we give to our kids is also, it should, it's, they see it differently, because
Mhm.
I don't know, I guess they see me work now more, so they're just
Yeah.
like, where is she? I don't know.
Well, it's funny because with some distance from remote learning, now that my kids are back in school, I have enough distance that I can, yes, have some gratitude for that
Yeah.
experience of like having them
Yes.
home and really getting
Yeah.
some insight into how
Yeah.
they learn. And especially my son was in 4th grade, and I remember his teacher was always harping on his handwriting. She was like, he needs, his handwriting is really messy. We need to
Mhm.
work on that. But I saw how when he started to focus on his handwriting, he would lose his train of
Mhm.
thought. He couldn't, he would get all this
Oh,
anxiety about
yeah.
how he was, he slowed down so much that I ended
Interesting.
up
Okay.
becoming like his secretary. And I was like, look, you just say things out loud and I will type them, because then he could kind of catch
Yeah.
up with his
Yeah.
brain, right?
Yeah.
And I was like, when would I
Yeah.
have ever had that opportunity to
Yeah.
do that for
Yeah.
him? But on the flip side, when your boundaries are basically thrown out the window because you're all in the same house, like that was basically how
Yeah.
I got my diagnosis, because I was like, I
Yeah.
can't freaking work. Like I
That's,
could not do anything for myself.
I
I felt
have a
like I was
lot
just
of people.
waiting, right? Yeah,
Mhm.
which was
Yeah.
like I had no idea when my kids were going to come bursting out of their rooms in tears
Yeah.
because of Wi-Fi or something, or just the
Yeah.
anxiety or Zoom. Like I had to be a full-time like butler for my kids.
Yeah.
And I didn't have a cleaning lady anymore. And like,
Yeah.
and
Yeah.
so it was like all of
You're doing
those domestic
everything.
boundaries were just
Yeah.
erased. And
Yeah.
so that's when I had a meltdown.
Yeah.
When my
No, a
therapist was
lot
like,
of
you need to
people.
look into ADHD.
Yeah.
Yeah.
A lot of people are presenting that way. That's everyone's day to day now. I mean, I've had patients where their kids are just, there's like Elsa in the background, there's Spider-Man on one side, mom's being darted with Spider-Man, webs and stuff. And she's like, this is my life. This is my life. And then it's like, also, if you're working from home, you don't have the division between your workspace and your home space. And all of a sudden it's like, is that the dishwasher? Is that like, what is that noise? And for some people, like they're working, your company, everybody went remote and maybe they're on different time zones. So people's phones are buzzing at different times at night. And that could be a source of anxiety. It's like, oh my God, what is that? Is that a work message? Did I miss something? Did I forget something? So you're constantly, it's like you're running in quicksand. It's just not going anywhere. And I think a lot of people what you described is what I see. And when I explain to people like this, your ADHD could be playing a part into this, they're like, I never saw it that way. I've always told like, hey, just do this or do that, or maybe it's always like, well, maybe I'm working more, so I'll work less, but I enjoy working. Why do I have to give up that part? This is always, you have to find a balance. But I'm like, no, you should be able to do whatever you want to do. No one can tell you that your 12 hours are not as important as someone else's 12 hours. That's not, or your 24 hours are not as important, or whatever the case is, or you have to work 10 hours or 8 hours or whatever. But if you are not comfortable with how things are going for you, let's see what we can do, and I think, but what you described is what I hear often,
Yeah.
especially with women.
Well, I was just gonna say, I think it's most starkly presented in terms of a gender issue from the pandemic, and how the
Mm-hmm.
pandemic and lockdown has affected women
Mm-hmm.
so much more than men,
Mm-hmm.
and especially wives and mothers, and in terms of the domestic duties
Yeah.
and yeah,
Like,
I mean, I feel
yeah.
like that's woven into our conversations all the time about,
Yeah.
how I'm always like, is this ADHD or am I just an angry feminist who's had it?
It's hard. I know the
Yeah.
balance is hard sometimes. You're just like, I don't know. This
Yeah.
is no, it's yeah, no, it does affect women differently, because women, especially this time, as you said, it becomes more apparent that women are the glue of the family. Like but at the same time, if you're not doing well, if you don't have those outlets anymore, then everybody suffers. And I think that adds more to that anxiety, more to because that mom guilt is real. Like if you feel like you forgot something for your kid, or you weren't there for something, or like that will really slowly break you down, and adds more to burnout. It eventually can, lead to professional burnout, or just personal, like you're tired with everything, and so yeah, I mean, there's a lot that there's, and if it is ADHD, like let's get that treated, let's get that assessed, so the quality of life is better.
Yeah, I know,
The
right?
quality of life that we're trying to help here.
Well, I so appreciate the I just think ADHD Online is such a fantastic service, and I think it's at
Yeah.
the right time, at the right place at the right time, and I think it's
Yeah.
fantastic. And now I was surprised to learn that it was actually originally founded for kind of parents and kids and getting kids diagnosed. But
Yeah.
I
Yeah.
imagine, do you know offhand what the ratio is of adult women to and adults to children in
I do
terms of
not know.
diagnoses?
I do not know. I will get that information for you though.
Yeah, I'm just curious because I feel
Yeah.
like
No,
I imagine way more adults come for a diagnosis than
yeah.
for themselves than for children. But
Yeah. Yeah.
I'm not.
Yeah. No, the number would be good to know. I would definitely ask the team those questions.
And
Um,
also, I think, not only is it a great place to go for an assessment, but it's a fantastic resource too, just in
mhm,
terms of poking around the site and the blogs. And there's
mhm,
also the webinars. I know
mhm,
this episode is not going to be out in time for the next week's webinar, but I know, is that
mhm.
something that you're doing more of?
Yeah, we have one next week on women, on relationships and COVID and ADHD. So just like with
Basically everything we
February
just
coming
talked
up,
about.
yeah, with February coming up, just kind of just want to do a little, talk on different questions like that. It's going to be with Dr. Savoy and
Terry
Terry and
Matlin.
myself.
Yeah.
Yeah, she's great. And then So we're just going to kind of, I think there's some questions out there that we're going to answer for some people, and just that's one. And then I think next month we're going to have another one. So we're trying to be more, have more resources for people who either may have ADHD or not have ADHD, or just interested in knowing more. Maybe they have a friend or their partner or their spouse maybe have it. They want to know how to be around, like, what can I do to be a more supportive person or more supportive friend or more or so I think we just want to be, we just want to be a great resource for the topic. I think that's kind of where our, because we realize, like, again, it's not just in kids, it's in adults, and we're living in a time where people just want to know more information.
Mhm.
So I think and then yeah,
And
but that's one.
streamline
And
the
then we also
process too, right?
oh
Yeah.
yeah, of course, make it easy, make it efficient, make it so that you're not waiting forever. And and then even once you're in, we want to make it so that it's efficient for you too. Like, it's, we want, because if you're someone's giving us 30, because a follow-up, I mean, a new visit is 30 minutes typically, and a follow-up is 15 minutes. We want to take away that time waiting in the doctor's office for 30 minutes with something. So you want to be able to, because if you're, everyone's doing a whole lot in the little bit of time they have every day, and we want to make sure that it's an efficient visit, an efficient time, and and if you're doing it in the comfort of your own home. Or I have people who, they're in the parking lot of somewhere, they're like, I'm here now, let's do this, that's the only time I have, and that's okay. So I feel like, just making it accessible, available, efficient, I think that's that's very much important to us.
Yeah. And I think if the last 2 years have shown us anything, this really is the future of how we communicate and how
Hmm.
we kind of
Hmm.
find help
Yeah, 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 yeah,
from the loneliness of our living rooms and our screens.
yeah. Times
Well,
have changed.
I really appreciate you sitting down with me. This was a really enlightening
Of course.
conversation. I had a feeling it would be. Is there anything else you wanted to make sure we covered in terms of ADHD online?
Well, I know, well, because the like our assessments are a big part of of the whole, how we big part of ADHD online. I think it'll be worthwhile having Dr. Savoy